component for young professionals who sometimes work too hard, do too much, or too much even, and are not very optimal lifestyle for skin health. So you can have a little bit more treatment, well-doing for your skin, having this big concept of the mesovitile treatment. This is the anti-aging due to these amino acids present in this substance. And of course, like already explained, it will also give the oxygen supply and regulation of the anti-oxygenation. So when you have components in your skin due to the civil working area where a lot of negative chemicals are coming into your skin, it will be correct. It will take care that no your cells are damaged due to this too much active oxygen. Because we have active oxygen which damages, which gives rust, and we have the good oxygen, the normal oxygen, which gives us the energy and which is needed for life. Then we have the third concept, and the third concept is even more power. This blue concept, which is called by the marketing medical appearance, has as an ingredient rosyluronic acid, which is giving the fluid and also the working space for all the ingredients of this system. But it has also, within these ingredients, an hexapeptide. And this hexapeptide has unique properties. The unique properties of this hexapeptide is that it reduces wrinkles. And I will explain how it can reduce the wrinkles. That was a slide which we don't split. These are the thoughts which we would like to get rid of. So this mesovitile method treatment is more for the elderly who already got some wrinkles, and the previous one was more for the young professional who wants to prevent wrinkles. The wrinkles will not be as much as seen in this picture, because this is really wrinkled. Next slide. But some wrinkles lighter, but less wrinkles. How do we get these wrinkles? For that we have to realize we have two types of muscle tissue. We have the muscle tissue. I don't see that portion anymore. Yes. These are the normal muscle tissue as we have in our biceps. But we have also our smooth muscles. And those smooth muscles, which are all over in the skin, we have to relax them. And we can relax them. Well known by techniques like chemicals. This is how our muscle is working. There are a lot of chemicals growing from the synapses, and they are going to receivers. Well, let it be, but it is interesting. I can give you a knowledge on this. You know this, how you can kill this system. This system, you can kill the synapses over there, blue one. You can kill all this chemistry by toxin, named Botox. And that's also why the snake, who produces substances like this, is putting Botox in your skin, because then you do not move and it's easier to swallow. We have to realize this is a toxin, so it has a potential danger. And for this, we have an alternative. On the left side of this slide, you see the normal release of tension in the muscle. When you get tension in the muscle, then you get neurotransmitters. Acetylcholine is small letters, so forget it. With the acetylcholine, they are getting all the muscle tissue together. goes in each other. And there's a snare protein we relax after that. It's another protein. So that you can relax. And again you can produce antibody and you can get your muscle tight. With botulinum toxin you paralyze it, you kill it. It's blocking the acetylcholine and nothing is done. So, smooth phase. It could also interfere in this mechanism. I already mentioned you all the chemistry which was behind it. And when you have interfering components in this chemistry, like this hexapeptide, then it's a very modest release of the muscle tension. And that would help you get a smooth phase. And that's what is done with the AMIA-MET version. So AMIA-Vital does not contain botulinum neurotoxin, but it's a non-toxic hexapeptide which interferes in the formation of wrinkles. And when you interfere in the formation of wrinkles, you have to do another thing. You have to fill a gap. Because when you interfere, and this is the theoretical background of interference, where you have this so-called snare complex, which is over there, which prevents the transmission of a signal from one nerve cell to another cell with a message to get power on the muscle. When this blocks, you will get more room, more space between the smooth muscles in the skin. And you have to fill it. Otherwise, you will have gaps. And you have to fill those gaps. And therefore, we use hyaluronic acid. And yes, indeed, as already mentioned, this hyaluronic acid attracts water, gives more space in the skin, gives more smoothness in the skin, and therefore, the nutritional status of the skin can be improved. And therefore, there are lots of components, and our pharmacists can tell about all the components in the mesovital components which are pushed into the skin with the AMIA system. So, in conclusion, and afterwards I can answer all your questions, I hope. It is a system in which, with 8 needles, at the same moment, you push a substance, one of the 3 versions, into the skin, which has as a main target the removal of the heat, the removal of all the rubbish which we collect in the skin into the drain, which is a medical, the lymphatic system. The lymphatic system, which is very, very important for cleaning up all the damaged old cell material, rubbish, bacteria, microorganisms which are killed by the immune system, all kinds of things. The lymphatic system is almost as important as our vascular system, which supplies the skin with blood and oxygen. It could have an immunological response, so we have to take care to have the right components in the skin. Because the same technology can even use for vaccination. That's more my piece of cake within the company. But realize it is important to have the right components already in the skin. We do not want that your customer will be a patient afterwards having allergic reactions. But when you are using the right components, it gives the fluid, nutrition supply and balance. There's also more space because the hyaluronic acid created space by attracting the water. And this nutrition can go to all the cells over there. The cells have the room, the space to grow. And then we get the oxygen supply, because for growing they need oxygen. Also, when there is active oxygen, so the single oxygen or the oxygen radicals, it will be removed by anti-oxygenation molecules like this famous one, the coenzyme Q10. And this, in fact, concludes my I hope I give you the message of the amino vital